In simple terms, what do you think self-esteem is, and why do you think it matters to mental health?
You'll be shocked to learn that a lot of people move around thinking that they're not worthy of anything good. They're not worthy of, good things happening to them. They don't deserve anything. And that is exactly the core of what is at their self-esteem. So self-esteem is so important. You wear it just like you wear your jewelry, your makeup, and whatever it is. Think of it this way. The way your phone operates on an OS, right? Operating system that your phone uses to make everything else function. All the apps function because the OS is updated. Your self-esteem is like your OS, right? Everything else rides on it. Your career, your relationships, everything is dependent on what you think about yourself.
So can someone appear confident but still struggle with low self-esteem internally? Is that possible? Hello everyone for joining, hoping every other people too would join us. The Real You Talk Show. So Real You just means that reigniting, empowered and audacious living, where we talk about topics on mental health and self-esteem. So it could be any of those topics, because without a healthy self-esteem and a healthy mental health, there's little we can do. We cannot maximize our capacity as a human and fulfilling our vision, our purpose, and also our goals. And health is not complete without mental well-being. Like, no matter what, mental well-being is a very core and integral part of our life, our well-being, and our health in general. So I have here an amazing UK-trained psychiatrist. Her name is Dr. Adetutu Kunuji. Do you want to say a brief hello and hi to? I'm just going to read your profile, but this is a brief hello to our audience.
Hi, everyone. Good evening. It's lovely to be here, or good afternoon, wherever you are in the world. It's good to be here. I'm so glad. When Tony told me that, would you come on our live show? I was like, yes, of course. I would not miss the opportunity for anything. So I'm really happy and grateful that you're having me here. I am a psychiatrist here in the UK. I practice in London, and I also run a mental health company. All right, back home in Nigeria. I'm the medical director of Mente Kalma in Nigeria. And basically, the message we're spreading to people in Nigeria is that mental health, there's no health without mental health. We want you to take your mental health as seriously as you take when you see that you have a blood pressure reading that is odd. We want you to take your mental health that seriously. And we try to provide it to you in a very affordable and accessible manner. So there you go. That's me.
Yeah, thank you so much. And that's why I have you here, because we kind of share some similar passion regarding mental health. So I'm Dr. Tori Shonubi, for those who's very new to the space. I call myself a mental health advocate and a self-esteem builder, because I believe health is not complete without mental well-being. And I've been on this advocacy journey and mental health field for so many, like over 10 to 15 years now, all the way from Nigeria and now in Canada. Although I'm a family physician, but I still have like a special interest in mental health and psychotherapy. And so this has been my long dream that I've been pursuing, making sure that everybody has some mental health awareness that will guide them in living a healthy life in general. So Dr. Adetutu Kunuji, she has MBCHB, meaning that she's a medical doctor, not just a doctor, different types of doctor, but she is a medical doctor. And then she also has MRCP Psych. That's a degree that you have, like postgraduate degree in psychiatry in the UK. She has over 15 years of experience in physical and mental health, including 8 years within the NHS in the United Kingdom. She's a specialist in general adult psychiatry and a member of the Royal College of Psychiatrists in the UK. Her expertise spans a wide range of psychiatric conditions, including depression, anxiety disorders, perinatal mental illness, covering women's mental health during and after pregnancy, and stress-related presentation. So she seems to have a bias for women. So she holds a certification in medical education and infant mental health, both from the University of Warwick in the UK and Workplace Wellbeing and Mental Health First Aid certifications. She's known for delivering patient-centered, evidence-based care tailored to each individual's context, especially for women and professionals navigating complex emotional and psychological well-being. She's also the medical director of Mental Karma. It's an initiative drives emotional well-being in workplaces and communities with a focus on women's mental health. Okay, so she served as a UN 2025 UN Women UK delegate. She's also an author of the Mother's Compass. This is a pioneering guide to navigating perinatal mental health challenges, and I believe that book, it's very practical from personal experiences. So you want to grab your copy. I'm also going to grab my copy because I've not gotten that yet. So she's a publisher. She does weekly mental health blog and newsletters, reaching audience with practical tools and insights. And she also brings cross-cultural expertise from working in both the UK and Nigeria, creating relevant and impactful mental health solutions. Oh my goodness. All our guests, can you please just give a love, like clap, just something to welcome our guests here, because this is like a very impressive profile. So she's coming with all our wealth of knowledge to give us something not academic, because we have a lot of people here from different walks of life, but something very relatable that will be helpful for us today. Thank you so much for the love that you show our guests today. So today we're talking about the hidden link between mental health and self-esteem. So for someone whose my niche is in that area, so I've realized over time from my experience in mental health field that there's a link, like there's a really hidden link, which we want to uncover today using practical life experiences. So dive into it right away. In simple terms, what do you think self-esteem is, and why do you think it matters to mental health?
So self-esteem is that thing that it's all about how you think about yourself. You think some people, you'll be shocked to learn that a lot of people move around thinking that they're not worthy of anything good. They're not worthy of, good things happening to them. They don't deserve anything. And that is exactly the core of what is at their self-esteem. So self-esteem is so important. You wear it just like you wear your jewelry, your makeup, and whatever it is. Think of it this way. The way your phone operates on an OS, right? Operating system that your phone uses to make everything else function. All the apps function because the OS is updated. Your self-esteem is like your OS, right? Everything else rides on it. Your career, your relationships, everything is dependent on what you think about yourself, and the outcomes, of it also depends on what your self-esteem is like. I think that's the way I'll describe it.
Yeah, that's very simple and short and very relatable for an average person. Thank you so much for that. So it's just about how you see yourself. That's just a simple truth about it. It's not about how other people see you, but what you perceive of yourself. And most times we kind of project it to other people and we think other people see us that way, which is not actually true. Okay, so can someone appear confident but still struggle with low self-esteem internally? Is that possible?
Absolutely, very possible. Again, this is something I've met many times. High performing women, you'd see, they tell you that they don't. Imposter syndrome is real. Some people are in positions, powerful positions, and they ultimately just think. I mean, they work hard every day so that they can achieve what they've got, but they do not think that they've done this. They always will belittle whatever it is that they've done. So you've seen lots of people that are very confident on the outside. They look like, they've got this. You see people in meetings, they're speaking and everything, but honestly, they can't take a little bit of a criticism because it
Mm,
completely shatters everything that they think they've built together as this is what I
mm,
look like, this is who I am. And so, yes, it's very possible to come across as confident to people, but
mm,
you've got a low self-esteem. Is very possible. I'll take for an example, this lady Viola Davis, right? She's Oscar award winning, even the lady who was in a How to Get Away with Murder. I don't know. She like,
Yeah,
and as you know, she's done lots of great work, right? But she, talked about the fact that for many years she struggled with feeling that, like, no, I'm not able to do this. I'm not. But you would never know that this woman who's winning all these awards feels this way internally. So it's very, very possible to come across as confident and all that. But really deep down, people still struggle with self-esteem issues.
okay. Thanks for shedding light on that. And I like the fact that you kind of touch a very important point, like not being able to accept criticism can be a sign of low self-esteem. Because really, like in life, that's the only way you can grow, like being like open to although not every time criticism is not always palatable, but having that like that willingness to accept it, even though it's not convenient, even though it's not comfortable, and reflecting on it is a very important aspect of having a healthy self-esteem. So diving into correlation between self-esteem and mental health, how does low self-esteem contribute to somebody's mental health, for example, anxiety?
Mhm. So for this, the research is really clear on this. Low self-esteem causes a person to continue to function in a place where they do not think that they're deserving of anything. Even if they apply for a job, they think that the job must have been really desperate to have picked them. They're in a relationship. It's really rubbish relationship. You shouldn't be anywhere close to that relationship. You just keep staying there because you're afraid that, like, if I step out of that, I'm not going to get anything better because I'm not worthy of it,
Hmm.
So these are the realities of how people can sometimes leave because of the way they think about themselves. And constantly thinking like that can cause one to then begin to experience, low mood. And we know that anxieties, low mood, social anxiety, all those things are very much linked to low self esteem. So we know that there is a link. Now, let's even go a step further. So, not just what we think or feel or whatever, but when you're in constant mood of thinking that you're not good enough, you're in constant stress, mode. And when
Mhm.
you're in a stressful situation, you are always afraid. Now, think about it, anxiety. What really, people that, I mean, people get anxious when something has happened and you're trying to cope with that thing. That is when you feel that anxious feeling. Anxiety disorder comes when someone is always in that state of mind, right? But a person who has low self-esteem is always anxious about everything around them, more or less. And so it's
Hmm.
very easy for them to, present with anxiety disorders. Now, when you're always in an anxious state, then your body begins to respond in all kinds of manners. You've got high cortisol. Cortisol is the stress hormone. So high cortisol levels. This can, obviously lead to several other things. It's not just It's not just a physiological or psychological what's going on. It's also biological. These things can drive you to even have physical health issues. So, yeah, there is a very strong link between low self-esteem and mental health problems, diagnosis, and even physical health problems.
Yeah, yeah, definitely. Thanks for shedding light on that, really, because being in that constant fight or flight state could really like that's anxiety state basically. And then I've seen people with social anxiety who the core of the social anxiety is because they feel like they are not good enough, like people will be criticizing them, they cannot stay in the midst of people. For those who don't understand what social anxiety is, just about the anxiety when you feel when you're in the midst of people, like whether known or no, maybe when you want to do a presentation, do a public speaking, and that's even like to the extreme. Some people cannot even have a one-on-one with a random stranger. They cannot go to outings, they cannot go to gatherings, and this is very crippling on their basic functioning. Imagine you want to date someone, you like someone, you like a girl, and you cannot even walk up to the girl and say, "Oh, I like you," because you're very anxious. You're thinking the girl will look at your big nose or your big ears and thinking, "Oh, this girl will think I don't have anything in my brain. I don't." Or maybe in the office, you cannot give a suggestion when you're having a meeting because you think they would think that you don't have anything to offer. So all those things can be can lead to anxiety. The next question: in what ways does low self-esteem feed depression or feelings of hopelessness?
Yeah. Yeah, so this more or less it is a continuation of what my thought process was before, right? So a person, I'm trying to get in the mind of a person who's got low self-esteem now, and that is the feeling of not being enough. You know, even in a good situation, you do not think you have earned the right to be there. And so one thing that we hear from a lot of patients who, when they say, when we make a diagnosis of depression, is the constant feeling, they feel low, yes, but then they also feel hopeless, they feel helpless, they feel like there's nothing they can do right. And then there's that loss of motivation, right? And these are all the things that are very, very common. They're very similar between low self-esteem and depression. So you see the links. If one is having that cycle, it's more or less like a cycle. I feel I'm not good enough, and then I become low, and then all the other symptoms of depression come in as well, and then the next thing I know, I can't even get out of it, so I feel less worthy of whatever situation I'm in, and then I go even lower because now I'm just like, I mean, look at it, I couldn't even get out of bed this morning, you see. So I'm right, I'm actually really low. So it continues to, the result of each step continues to worsen the cycle, something like that. So it's a really huge problem, and you'd find that even in depression work, when people are being treated with either, let's say, CBT or something, even psychoanalytic psychodynamic therapy, you'd find that one of the things we try to work on is how a person sees themselves, what is their interpretation of who they are, and because we believe that our thoughts would influence our feelings, and then it influences our behavior, and that is the CBT's triangle, right? And so essentially the thoughts that you're talking about, the low self-esteem thoughts continue to worsen your feelings, and then they cause you to have some behaviors that will definitely be detrimental and cannot help you get out of the cycle. So it actually does worsen depression a lot. Absolutely.
Yeah, definitely. I agree with you that sometimes underneath the cause of the depression is that feeling of worthlessness. I remember those days you ask, do you have feeling of worthlessness, helplessness? Those three things usually go together when they don't feel worthy. For example, maybe someone who is like in the like, even like, for example, you're in perinatal psychiatry, people that have just had children, they don't feel like they're capable of taking care of a child. Like, am I supposed to do this? And that thought and all that makes them feel, it makes them feel that they are not capable of being a mother, of taking care of a child and all that. And if that thought lingers for a long time, it could like lead to low mood, depression and all that. Yeah, so we can never overemphasize the fact that having a healthy self-esteem is directly correlated with like having a healthy mental health and overall health in general. Okay, so can improving self-esteem actually improve someone's mental health outcomes? I know we've kind of answered it in a way, but
Absolutely. Absolutely. So let's put it this way. So there's some of the patients that I see, and I tell them to try some of the things that, I tell you to try. Sometimes I'll say, think about your pleasurable thoughts, right? Things that you would like to engage in, pleasant, things to do. Then some things would be compulsory, you have to do every day. So for instance, compulsory things would be, I have to get out of bed, I have to take a shower. It's not compulsory for everybody, but I'm just because anyway. So but yeah, that would be maybe a necessity. But then the pleasurable things to do, for some people it might be, what do I enjoy doing? I really love music, for instance. I enjoy dancing. So that would be a pleasurable thing to do. Now, it would shock you to think that a person that has got low self-esteem does not even believe that they're worthy of the satisfaction that comes from doing something that you enjoy doing. So so some of the homeworks or CBT homeworks that would say engage in this week, you'd have for each day, you have to engage in something pleasurable, right?
Mhm.
And something
Mhm.
compulsory that you have to do. And then they begin to find that actually, when I do certain things, I get some pleasure out of it. Now, that's all you. It didn't involve me in any way. I didn't come into your house to engage in whatever it is that you're engaging in. And then when they begin to see the result of what they have done, because obviously before we get to that stage, we have already begun to work on thoughts, feelings, and behavior, how all of these are linked, how you begin to identify negative thoughts and how you can isolate those thoughts and challenge them, because actually those thoughts are not real. Self-esteem issues, a person just for no reason thinks, I'm really, what can I think of? Um, I'm really ugly. No, you don't have anything to prove that. What do you have to prove that? Prove it to me why you think that way. Or, I'm just not good at my job. I'm not good at math. No, you're just not trying to engage yourself in it. If you try to engage yourself in it, then you would see that I can be good at this. And then you begin to build on that and isolate the things that make you so you'd realize that it's just your mind telling you lies about what you're able to do and what you're not
Mhm.
able to do, what your capabilities are, what your judgment is like. You can begin to trust those things, and then you can begin to build on top of those things. So we want them to engage in things like that and to think about pleasurable things. And the more they do those pleasurable things, they find a lot of improvement in their symptoms. You actually see improvement in the rating scales, depression
Mhm.
scales. If you're using that, you actually see people improve a lot in terms of their symptoms. And they're like, oh, it's like magic. No, it was all within you to begin with to fix. So yeah, if there's anyone on this call today that is wondering how can I get out of this, it's all within you. You just have to begin to be more conscious of the things you're able to do.
Yeah, definitely. That's what we call like behavioral activation, right? Sometimes when people have been in that low state for a long time and they've told like that lies that keeps coming into their mind and all that, they keep all those pleasurable moments in the back burner, pleasurable activities. Some have even like I remember I always ask them, oh, what are the things you love doing? They can't even remember. Because they've been in that depressed state for a long time, or they've told themselves that they can never enjoy good things, or they can never, they've been in a very bad relationship for a long time where they didn't have any life outside of that. So to keep reminding them that okay, you have some values, right? Helping them to even using like gratitude journal, helping them to see the good side of them that they've long forgotten and all that. So that's really yeah, helps in a way. Okay, so how what role does childhood experience play in adult self-esteem?
Hmm, I like that. I like that question so much because it's so important how we raise our children. It's so important. The first experience they ever have, the first contact they ever have with humanity is with us as their parents. So it's so important that you build up a lot of confidence in your child. We have seen, research has shown to us that children who develop in, families or backgrounds where they're heavily criticized would have an issue with their self-esteem. So it's advisable if you've got children. I know that no one has a perfect child. Obviously, there is the role of correcting. But at the same time, the Bible will say correct in love. I guess what I mean is that when you criticize that child, when they do the right thing, it's so important that you also tell them that, oh my God, you've done that. That is so amazing. You're so brilliant. I can't believe it. You know, because those positive things they are saying to them, it stays with them. Children within the ages of 4 till 12, that's when they actually begin to build up their confidence. And especially if you're in a different climate, you're not in Nigeria, please build the confidence of your child, I beg you, because they're different. They look different. They know they look different. They're taught in school that they're different. but they need to know that they're different and shiny and bright. So that is your role. You have to pump it into them, because actually the truth is that there's no child that doesn't have something, you know, special that they can do well. Even neurodiverse children, I'll go into this for a minute. Even neurodiverse children are really good at one or two things. Focus on those things and tell them how great they are in it.
Hmm.
Yeah.
Can you tell us what because for some people who don't understand what neurodivergent student people are?
Yeah, I'm so sorry. I'm so sorry. So yeah, I'm sorry, because yeah, everybody's like, I'm neurodiverse. Okay, never mind. So, autism is neurodiversity. Neurodiversity just means that there's nothing. I mean, I know that people come to my clinic and they say to me, "Oh, if I was just normal," I'm like, "No, actually, you're normal. Everybody does not have to behave the same way. Your brain interprets things differently, and that is the important thing about neurodiversity. People who's got autism or attention deficit hyperactivity disorder, otherwise known as ADHD, these are people that are called neurodiverse. And I just think that there's a lot of beauty in seeing things the other way. There are a lot of creative people who we've now gotten to find out that actually they're neurodiverse. They're so creative. An ADHD person can turn out lots of, tasks. If they focus on what they like to do, they're able to do that, and they have a lot of energy to get it done. I'm just saying, focus on what you're good at and do it. And even for a child, find out what that child is good at and help them develop that. A lot of people who've got autism are mathematicians today because they focused on that thing they're good at. They're chess masters today because that is what they're good at, and their parents help them to really, really develop that skill. So yeah, I see it as a superpower actually, rather than anything else.
Yeah, so I heard that Albert Einstein was had Asperger's syndrome, which was like it's like a spectrum of the high functioning autism. So no one is a waste. So as a parent, our job, our duty is to identify the strength of a child and help them to develop it. Everybody's strength is different. Instead of you comparing and say, why don't you be like this? They may not be good at what you're comparing them with, but they have their own area of strength that we need to harness. Because by the time we start comparing, they become adults who become very competitive, unhealthy competition, envious of others. They cannot stand people's success, and they have low self-confidence in their own ability. So parents, we have a great role to play. So I did like IG live like last month about like self-esteem in teenagers, and I'm dropping the video on my YouTube soon. So that would be very explosive. Also, that very explosive moment on how parenting would help to build teenagers and children's self-confidence, and that would be very helpful. But that's not the topic for today. So if you want more information on that, watch out for my YouTube video. Okay, so the next one is, how does negative self-talk impact anxiety, depression, or stress levels?
Oh, I mean, so we touched on it a little bit earlier. So a person, really, let's think about it. What's negative self-talk? Talk. It's basically, you have something to achieve. I am not able to do it. I don't have the skills. They will find somebody else to do it, I'm sure. Let me make it a bit more practical. Your career in your office, you've got a fantastic idea of how to there's a problem, so some kind of problem you're trying to solve, and you have a fantastic idea how to do it, but here's the problem. At the board meeting, you can't even raise your hand to say that I can do this. You can't even even if somebody, then you're not raising your hand, but someone says, oh, Miss Ajale Coco, do you have suggestion? No way, because the words won't just come out, because you think, oh my god, they would realize I don't speak good grammar. That is how negative self-talk damages a person
Oh, my
in
accent.
my my accent. I still have, I have H factor. So there's something or the other that will stop you. or what's it called, then you've even moved ahead. Maybe somebody now says that, oh, this is your task, you need to complete it. I don't have the skills. Oh, I don't, I'm not good. I was never good at math. So this thing that they said I should do, I don't think, no, I won't be able to do it. So this is how. And imagine a person that every decision during the day, this is how they doubt themselves in everything that they have to go through in a day. It can actually be very tiring, very, very tiring. Because even if you're trying to challenge that thought, it's pretty serious task to challenge every thought that comes to your mind that, oh, you can't do this, you can't do that. Yeah, but this is real. And so this is why it definitely worsens the trajectory of pre-existing any mental health condition. It definitely worsens the outcomes. But it's not that it's impossible to get better, because as I always say, how do I describe it? I mean, obviously, depending on what your mental health professional advice is, but I always say to people that sometimes when people have been diagnosed with some, mental health condition, like depression or anxiety, these are things that people are realizing that it's really common. 1 in 4 people in the world would have, some kind of mental health challenge at some point in their life. So it's really common, and we shouldn't shy away from talking about it these days. Therefore, a psychiatrist has written you medication, antidepressants. I say it to people that you're trying to climb a 3-story building as a person who's very exhausted. You've got no food, no water for the last 1 week, but you're supposed to climb this three-story building. Is it possible? It's not possible. You need extra help, whether it's a ladder, staircase, whatever. This is what you should think the medication is like. It props you up until you have the skills to move forward. So for me, and I mean, you realize that this is what we try to talk about in mental health. Generally, we say management is biopsychosocial, isn't it? So the biological part is what the medication is taking care of. The psychological part is why I would say go for psychotherapy, right? And the social aspect of it is what are the people around you helping you with. So I'm always very excited when I see people who've come into the clinic with their family, their husbands, their brothers, their whatever, because that means you have support already 1 step ahead of a lot of other people, and also your self-esteem obviously can be built up, like we said, around when we talk about children, the people around you really matter. So sometimes you don't even believe in yourself, and then you have someone tell you that, hey, listen, you can do it because I've seen you do X, Y, Z. So this is something that falls within your remit. I'm pretty sure that you can do this. So don't belittle the comments of people around you when they say these things to you. And these are the ways we try to shift negative talk and help in treatment of it. And this is how on the flip side, if you don't have all of these things, it can definitely worsen the mental health.
Yeah. So yeah, I get the fact that you mentioned that we should always take note of the positive things around us. Yeah, because I know in therapy they also mentioned that having like a gratitude journal, also like being intentional about your day, right? If somebody gave you a positive compliment about maybe your shirt or something, write it down about I love the idea you gave at the meeting today, right? So those are the evidence that you're going to gather to challenge those thoughts when it comes that, okay, yesterday I gave a very great suggestion and I didn't die. and it was great. I had a positive feedback, because most times there's something we call dysfunctional thoughts. We kind of focus on, based on our like automatic thoughts, dysfunctional thoughts. Some people, they minimize things a lot, and they maximize, they magnify negative things. So people with low self-esteem, they kind of minimize their strong points, and they magnify their weakness, right? So it's about finding, everybody has his own weakness, but you don't just capitalize on it. You work on it and you grow from it, right? But your strong points, you bring it up forward. You create a gratitude journal on it, and you're able to appreciate yourself. That's how you're able to build that appreciation. So thank you so much for letting us know that even in our day-to-day activity, we need to be able to recognize those positive moments and take note of it, because it's very important. And then, of course, also like surrounding yourself with positive-minded people, because there are some people that are very, very toxic.